Welcome to the Greater Pensacola Chamber Toddcast, sponsored by Moorhead Real Estate Law Group. On the Toddcast, Chamber President Todd Thompson talks to the leaders that are making a difference and driving the conversations that will impact our community. Now here's the Chamber President, Todd Thompson.
Welcome back to the Greater Pensacola Toddcast. I'm Todd Thompson, President and CEO of the Greater Pensacola Chamber of Commerce. Toddcast is sponsored by Moorhead Real Estate Law Group. So if you have any questions about any real estate deals you're involved with, good people at Moorhead Real Estate Law Group will answer your questions and help you out. So today on the Toddcast, fortunate to have Mark Faulkner, President of Baptist Healthcare here in Pensacola. And first of all, Mark, welcome to the Toddcast.
Well, thank you, Todd. It's a pleasure to join you today.
Yeah, well, it's been quite a time here lately. And I know we were talking last week at the PACE Awards that you got the call for the first case here at Baptist at last year's PACE Awards. So it's been kind of a whirlwind, but here we are in 2021 and looking forward to some good things. So looking forward to talking to you and hearing about Baptist's plans. I know you've got some exciting things happening here, so looking forward to delve into that. But first, let's start with COVID. Just, here we are a year later, things are looking better, but how has Baptist adapted and adjusted to deal with this during this just crazy time?
Yeah, well, it has been a crazy time for everyone, including healthcare and including Baptist healthcare. Certainly, like you say, a year ago, when I got the whisper in my ear that we just admitted our first presumptive positive at Baptist, and it was the first in the community, only the fourth in the state of Florida. So yeah, we were in the fight early, and we did have to begin to make rapid adjustments very quickly into this. And when I mean rapid adjustments, I mean from a worldwide search for PPE to protect our patients, protect our caregivers and the community, as well as just sort of understanding, how broad is this now, and propping up testing. We had to rapidly go into that. As we saw the growth and spread, we put in place facility expansion plans that we did utilize from time to time during our surges, where we would move our inpatient areas into parts of the hospital that normally don't care for patients. So we did have those surge plans rapidly in place and deployed. We propped up a testing apparatus for our employees, for our patients, and for the community. But also, like many people, we switched to telecommuting. We sent over 2,000 people home to work, many of which are still working from home today. And we're all kind of still sorting through, what does that mean near term and long term? Who comes back immediately, who comes back eventually, who never comes back.
Right.
And so we're still sorting through that as an industry, as are many industries, in fact. We propped up telehealth. We've done well over 120,000 visits now remotely, where patients can access their doctor here locally by some sort of device.
Wow.
And that's provided, again, access while maintaining safety. We have seen therapies. When this thing came, we had no idea who had it, no way to test it, and no way to treat it. And of course, since then, a lot has happened, including the way we care for patients with COVID.
Right.
And what was seen early in New York City, for example, with the significant mortality rates, isn't what we've seen here in Florida, and certainly not here in Pensacola, with better ways to take care of patients once they have in fact tested positive. And then we've sort of had a role, strangely enough, with policymakers. Normally healthcare, we exist to help heal the sick or repair the broken, but this was kind of a public health issue, right? And so we have spoken as a voice, as an industry, we being all of healthcare in our community, the other hospitals and community health of Northwest Florida, as policymakers have reached out and said, what do you think? What should we do? What are you considering? What's happening inside the walls of the hospital? Normally, again, we as a hospital industry, we exist to care for sick. For example, if someone gets in a car wreck, they come to the ER and we care for them.
Right.
We don't investigate if they were texting and driving, or if they were speeding or what have you. That's law enforcement's job. Well, in this pandemic, normally they would come, we would care for the sick, but public health would figure out who's got it, where's it spread. Well, in this case, healthcare became part of public health because it was just so overwhelming. And so we began, as an industry, involved in contact tracing and testing and research, all the things that normally would be solely in the swim lane of public health, which has been unique and interesting and rewarding. And hopefully it's been a good partnership with, again, local and state and even national policymakers. Right. And then finally, last, to round it out in this year, we're now heavily involved in the vaccine deployment.
Right.
We got our first dose for distribution December 21st. We've since administered over 17,000 vaccinations. If a year ago you would have told me we'd already have a vaccine in place, I would have said, God bless you. I don't believe it.
Yeah, right.
But it has been a long yet rapid journey to get from our first patient to, now we've, vaccinated a significant percentage of the population. So what a year it's been.
Right.
And I think in part we've been able to adapt because we're local, right? We're owned by the community. It's all led by the community, governed by community volunteers, which allows us to be very adaptive, right? Things happen, we jump in. There's a need, we fill it. And so I think that's allowed us to be fairly nimble in this whole year.
Right.
Yep.
Now, you mentioned the policy portion of that. Now, you were appointed by the governor to be a part of that. Talk about that a little bit.
Yeah, I was. The governor reached out looking for folks to serve on a panel advisory group, and specifically on testing. How do we ramp up testing in the spring and summer of last year and rapidly deploy that? And that led to, the site we had at UWF that was wide open. It led to advancements in accelerating testing availability in our community and throughout the state. It was led by the CEO of Florida Blue, and it was a very, I think, impactful opportunity to have a voice from the Panhandle, specifically at the time on what was an urgent matter, and that was testing.
Right, right. Now, you mentioned the vaccine, doing distribution now. What's sort of the latest on what people need to know about that? Yeah,
so it's first of all, I continue to encourage people to get it. Let's just start there. It is proven to be safe and then proven to be effective. And the only pathway to the other side of this pandemic is herd immunity. And the only pathway to herd immunity is people having the antibodies. Either they got it, which is risky, or they got the vaccine. So we're excited now that Johnson & Johnson is being distributed in the community. Moderna, Pfizer, we're seeing significant more vaccine availability today than we did back in December. So what has been the critical limiting factor, and that is vaccine availability, is rapidly diminishing. And as the governor adjusts the plan to availability, starting with 65 and older, now 60, and then eventually 55. He just announced today, which is March 16th, by the way, he just announced today that he expects to opening up vaccine availability to all Floridians no later than the 1st of May.
Right.
So I think we'll be in a much better place. So now our role, I think, as a healthcare provider is partnering with the departments of health, partnering with other community partners like Community Health of Northwest Florida, even the retail outlets like Publix and CVS and Walgreens and all the others that are coming online, and partnering with different communities. We've been engaged with the minority community here with the Brownsville Community Center. We have been engaged with the faith community through our Faith Health Network. We have 68 churches that are part of a partnership, and now making that much more readily accessible to them, even with employers, and having a partnership that's newly formed with Navy Federal to work with them to get vaccine availability to their team members and to their family members. So to help all communities, whether we're trying to get the economy cranked back up by getting employees and employers back to work, to faith communities, even to communities that don't have the accessibility that others would. So we're trying to spread out and hit all those areas.
Yeah, and you touched on this earlier, but I think a key component of that is being local and being known and being trusted. You're not coming in from out of town or getting orders from somewhere else. You're in our community. You know our leaders. You know the people, and they know you. So that helps build that level of trust. So when you're reaching into some of those communities, it makes it easier to deliver the message.
Well, we're a big small town, and
Right.
I think that those relationships matter, and to be a trusted partner to turn to for help. And the Navy Federal is a great example.
Right.
It was a text, a phone call, and 2 days later we're there. That's just how it works in our community most effectively. But as you know, relationships are based in trust.
Absolutely. So we're sitting here in your office here, E Street in Pensacola, but during all this, you've had an announcement and a groundbreaking. So let's talk about that a little. The future of Baptist here in Pensacola, exciting new things, and tell us about.
Well,
that.
we are incredibly excited about our new replacement campus on the corner of Brent Lane and Interstate 110. In this world of 2020, which was many in our industry shelved plans or scrapped plans for expansion, we actually accelerated our plans. And fortunately, we were at a stage in this journey where much of the work that was happening was all design.
Mm-hmm.
And where you're working with architects and design firms and even the general contractor and subs. But you're doing that, all on a desk or on paper or on computers, which typically would involve them a day of travel,
Right.
3 or 4 days on site, and then back home.
Yeah.
Well, when we flipped to telecommuting, so did they. And so we were able to accelerate the design phase of this by working with folks in Jacksonville and in Birmingham and Atlanta and Nashville, as well as a lot of folks locally in designing this new campus. So it hasn't missed a beat. In fact, we were able to learn in this pandemic, what could we do better in terms of designing our facilities to meet the need of a next pandemic, God forbid. So we incorporated those elements into the design. So we spent 2020 dealing with the pandemic, dealing with the storm and bridges and everything else, but we spent 2020 designing a new campus.
Right.
And so in October we had our groundbreaking, 71 years to the day of our original groundbreaking here on Ian Moreno, and off we go. And here we are mid-March, and this morning at 4:30 we had our first 22 trucks, concrete trucks, pouring the foundation.
Oh wow!
We've sank the pilings and the platforms, and now beginning to come out of the ground with concrete, and we'll quickly start seeing above the ground progress. And so we are thrilled with how this is working out. Literally on the early, about a year ago, as the pandemic was starting, we held a huge event down at Brownsville Community Center.
Mm-hmm.
The goal of that event was to invite local vendors and subs, minority-owned, veteran-owned, women-owned. Come on, let us explain how this is going to work. Because if we're going to spend $1 on construction, we want that dollar to stay in Pensacola.
Right.
And had that multiplier effect. And so we had over 300 show up, and it was a phenomenal event so that they could hear from the general contractor. Here's the process. Here's how we can get to know you. Here's the sequence and timing of these different parts of the bid process. Because Brassfield & Gorey, who's our general contractor, is completely on board and supportive of those dollars that we spend stay in Pensacola. So we have continued to stay true to that commitment. We broke ground in October. We're coming out of the ground this week. We are still on budget, on track for a September, October opening in 2023. So we're about 2.5 years away from seeing our first patient on the new campus. And that new campus is exciting. We We cobbled together 57 acres by 35 different owners, very quietly,
Hey, right.
by the way, very quietly, to get a footprint that would be able to accommodate a campus our size plus growth, and to do so in a way that still met the needs of our local zip code where we sit today, plus became much more accessible to the broader community.
Mm-hmm.
We had the Haas Center look at it as well, and just trying to understand the economic impact. And 4,200 construction jobs, over $200+ million in wages that'll stay here, plus ancillary, another 75 or so million in ancillary wages, all part of just the construction of this campus.
Right.
And so again, I think when you think about what this could mean to Baptist, it's impactful. Certainly, it's impactful to have a facility that'll meet the needs for the next 70 years. And I think it's just part of jump starting us back to where we ended a year ago, and that was Pensacola is rolling.
Right.
Things are looking great. The Chamber's done a fabulous job. Economic development is going well. We had a hiccup and a pause, kind of pressed the clutch in 2020 with the pandemic, but here we go again.
Right.
I think we're nearing the end of this pandemic. We're certainly seeing positive economic signs in our community and in our state, and we want to be a part of that.
Right.
With the revitalization of downtown, we want this new campus to be the new front door to downtown. Hospitals and healthcare, we're an economic driver. We employ a lot of people.
Right.
But it's also an important underpinning and infrastructure to growth. What do you need to attract employers? You need healthcare, you need education, you need amenities and things like that. And we certainly are partnering up to make sure the community and potential employers that want to relocate or considering Pensacola see that healthcare is top shelf.
Right.
And so, this is a huge investment. In fact, it's the largest healthcare investment in the history of Northwest Florida.
Wow.
The largest single project, $615 million. So again, it's one piece of a big puzzle of Pensacola that I think's hopefully a positive injection into what's going on here.
Absolutely. So before the pandemic hit, you were having meetings about what to do with your footprint here. As you said, you've been here 71 years, still part of this community. You were looking for community input from the people who live right here around the hospital to make sure that what you do here, doesn't negatively impact them and that they can benefit from what the future looks like in this footprint. So talk about that a little bit. Like I said, we had some meetings and then we had to, not be able to do that for a while, but what's the vision for where we sit today?
Absolutely. Yeah, we pulled together a community advisory council. Thank you for serving on that, along with neighborhood association leaders, local employers, local pastors, elected officials, the community at large. Many people were engaged and have been engaged. We sought out advice and counsel. We're going to be moving all of our hospital operations, outpatient operations. We're moving our physician offices, and even our behavioral health, where all of that's going to vacate 50 acres. And originally, going into this announcement in June of 2019, I guess it was, I had committed to say, if there's a job that can be left on this campus, we're going to leave it on this campus.
Okay.
The day after literally the day after our announcement, we convened our first community advisory council. And since then, that council has said, do you have to leave those jobs here? Okay, help me understand that. There's a recognition that although we're an economic driver located in 32501, we're not an economic driver of 32501.
Okay.
Around our existing campuses, the campus here at Ian Marina, there are no significant businesses, restaurants, gas stations, hotels. There's not. Yeah. Many of our people work here and return home elsewhere. How can we convert and create a win-win for this campus that actually is an economic driver to 32501, 32505, and other parts around the existing campus. And so it was a paradigm shift for me as we heard more and more, we could actually do a lot more if Baptist wasn't here at all. Because we had thought, we'll leave our administrative jobs here and support functions, and we still might leave some of that. But along came COVID, along came telecommuting,
right,
and along came the perceptions and input from the community that says, we might could do a whole lot better if we just had a clean slate of 50 acres. Okay, so we don't know the answer to this question right now, what will remain on this East Street campus. But we know this, we're going to make those decisions with the benefit of the community in mind,
right,
and with the voice of the community being heard. We don't need to excise value to return to shareholders. We want this to be a value opportunity for our community. And we don't know what that looks like, but there are some smart people in our community that have a better vision in that.
Right.
Could it become multi-use for housing, for retail, for community development agencies, for other things, educational space that can be a game changer for this 32501. There aren't many communities that have an opportunity like this at 50, maybe even up to 75 acres if Lakeview's part of this, located near an airport, near the waterfront, near downtown, that all of a sudden becomes available for total reimagination.
Right.
Well, that's what we're up here to do. We know we're going to have a win with a new hospital. We want to create a win-win by having the availability of redevelopment here at the East Street campus. And so it's been a great process. Even in the pandemic, we were still communicating with the council and council members. Jen Grove is kind of re-engaging that group as well. We've got time to make this decision, 2.5 years from moving, and we've got some time to figure out what this could look like. So right now I don't have all those answers, but I do know the process is going to involve the community.
Right. And that's been something from the get-go. I mean, you and your team, you always hear about community, the impacts in the community, helping the community. And from, my experience with you, you're on Achieve Escambia, you've been the chair there, First Place Partners, economic development. So it's not just healthcare. You and your team really look at kind of the whole umbrella of what's happening here locally and having an impact on that. So talk about that a little bit and the areas that your folks have really made an impact.
Well, that's probably my favorite subject. Growing up here, this is home for me.
Yeah.
Mom and dad still live here. My brother still lives here and his family. And it's just a special place because of the people. And when I think about my role at Baptist and our role as Baptist in the community, it's certainly healthcare, right? But there's so much more to that. And when I succeeded Al Stubblefield as CEO and began to see the role through different lenses, right? And you understand the impact that the organization can have, that corporate social responsibility and community impact. And unfortunately, Escambia County doesn't fare so well when it comes to health outcomes. We have 3 great hospitals in our community. We have incredible physicians and caregivers in our community. Why is it that Escambia County is at the lower third of those outcomes in the state of Florida? And then you start going to this economic development meeting and you see, why is it that Escambia County is in the lower third in terms of financial stability and poverty and ALICE rates? Or you go over to Achieve Escambia and get into the education space. It's the same story. When it comes to state rankings, Escambia County has struggled, and I think it's because they're all connected. We want to move the needle in healthcare as Baptists, but as we do that, we quickly start talking about poverty or education.
Right.
I do chair the Achieve Leadership Council, and we talk about educational outcomes and improvement like kindergarten readiness and graduation rates. And as we try to move that needle, what do we talk about? Poverty and healthcare. And then when I'm involved in economic development activities like First Place Partners and other things, we talk about financial stability. And what gets in the way of that? Education and health. These three legs of the stool, as I say, they all fit together. And I see our role, Baptist, as a community-owned organization, our role is to elevate quality of life in health and also in these other sectors. It isn't just Dr. Tim Smith's challenge for education, it's the communities. It just isn't Baptist or Sacred or West Florida's issue on health, it's the communities. And same is true, it isn't the Chamber's concern about poverty, it's everybody's concern. They all fit together. And so the way I see it is, how do we invest our resources, time, talent, and treasure, into those levers that move all three of those legs of the stool, where they all intersect.
Right.
And to have community partners, big ones like Navy Federal and Gulf Power and Sacred Heart, as we came together and started Achieve. And Baptist, of course, is a founding member of Achieve Healthy Escarosa, which used to be the Partnership for a Healthy Community, and then Live Well Partnership, and now Escarosa. As we start looking at health indicators and outcomes, and we disaggregate them and look at equity issues in our community, these are all real. And so that's how I see our role. We're not just here to provide great health care inside the four walls. We're here to impact the community outside the four walls. And if you look at health outcomes, frankly, 10% of longevity and quality of life in terms of health is driven by what we do in healthcare. 30% is driven by the genetic code you inherited. Everything else is all environmental and behavioral choices. Think about that. The majority of our health outcomes are based on food deserts. They're based on access to a healthy environment. Education is based on poverty. It's based on lifestyle choices, things that get us into drugs or alcohol and other things. The majority of our health outcomes are what we choose or what we're exposed to. And so I want to be really good in that 10%, and I want us to be very impactful in that 60%.
Right.
And I think, again, that's where those legs of the stool come together. So I think it's Baptist's role. But I'll tell you this too, Todd. I'm inspired when I interact with other community leaders, elected officials or small business owners, large employers and CEOs and the like, when they also see it the same way. They might say, how do I get involved? How do I be impactful? It's these ways where there's a recognition that we all live in and love this community, and how do we make it better? It's by, again, involving ourselves in things that truly do move the needle. And so it's inspiring when others step into that and want to be a part of the solution.
Yeah. So, that brings me to my next question. How can the business community support you in these efforts, support the community in these efforts, and make that change that we're all trying to achieve?
Yeah. Well, we all have, I think, an opportunity to be impactful. Some larger platforms, some smaller platforms, but we all have that opportunity through our availability and our interests and our desire to make this a better place. And I think that when we seek to engage in the community, we have to recognize what's my swim lane. I'm in retail, or I'm in manufacturing, or I'm in banking, or I'm in whatever I'm doing, education. But then there's so many ways that your business or your organization has reach into other parts of the community. And how do they link together? As we say from time to time, we are a program-rich, system-poor community. We have a lot of boxes and a lot of resources that do great things, but we're just not always connected.
Right.
And not connected in the ways that truly have a force multiplier effect in driving improvement and in driving change. So I think there are opportunities, again, focused on quality of life, which drill down is health care, it's education, it's poverty, and finding ways to fit in that space. I think the Chamber does incredible work. And we're a huge believer in the Chamber. Jen Grove, of course, serves on the board.
Yep.
Victor Hall chairs the Defense Alliance.
Mm-hmm.
Both are executives at Baptist, and many other ways. I think that, like it said, when no one cares who gets the credit, it's amazing what work gets done. And
yeah.
I think, who cares about credit? I just think it's about outcomes.
Yeah.
And we all benefit from that. And I think Pensacola, we've had a great run, and I think we're actually on the cusp of even better days ahead in all aspects of that. And I'm excited about where we are in 2021. As I've said, if 2020 was chaos and calamity, 2021 is healing and hope.
Yeah.
And we're seeing it here in the middle of March. I am so optimistic. I read these polls, CEO optimism index, and they haven't asked me yet because I would be an outlier.
Right.
I am incredibly optimistic,
yeah.
but I think it's because I sit in Pensacola and they don't. And I see what the great things that are happening here, and I'm just excited to be a part of it.
Yeah. Well, and I just want to say thank you for Baptist support of the Chamber. As you mentioned, Jen Grove's on our board. She's been providing the updates at every board meeting on what's happening with COVID and the response. And Admiral Hall, with his work on the Defense Alliance, has been fantastic. Getting to know him better, great guy. And kind of echoing your comments, if we're all at the table and we're all working on these things and we can all share in the success, we can all take the credit together, because, that's really the only way you're going to do this. And, you were talking about getting things aligned, and, that's been a big focus the last few years, is getting, you said we've got the resources, we've got programs, but getting them aligned, getting them moving in the same direction. And there's so many people now that I think are buying into that and understand the importance of it. So I agree. I think 2021 is shaping up to be a fantastic year. The jobs numbers that just came out are looking better and better. I think our community has again shown its resilience. You mentioned hurricanes and bridges and all those things. We've been through this stuff before, and we just fight through it and keep going.
I think you just hit on the key point. When you look at this past year, and gosh, even from our very beginnings as the first settlement,
right,
this community has been about resiliency.
Right.
And resiliency only comes through adversity.
Right.
And we have been tested in the fire, whether it is storms or whether it is pandemic or whether it is the NAS shooting, or you name the challenge, we have seen it and we have endured, and we are better for it.
Right.
And so I think that at the basis of it all is that we have seen things as a community, and we have emerged from those as a community, and that just makes us better.
Yeah, agree. So much, and it inspires me. I mean, it really, seeing the way this community responds to adversity is really inspiring. So as we wrap up, any closing messages or things that you want to share with our listeners?
Yeah. First, thanks for tuning in. And it's, again, Todd, thanks for the opportunity. I would say this. If there are ways that Baptists can better serve, please reach out to me. Reach out to any of our leaders at Baptist. That's why we're here. We exist for the community. We don't have a headquarters somewhere. We don't have stockholders to answer to. We answer to you. And I want to hear from you. I want you to be the voice from the community and the ears to the community. So please, I would just encourage you, share your insights, share your input with us, and we just want to be better and better.
Yeah. Well, again, Mark Faulkner, thank you so much. Thank you so much for Baptist and everything you do for our chamber, for our community, and looking forward to continuing on this path as we move forward and have a prosperous 2021. So, that'll do it this time. Thank you for joining us on the Toddcast.
Thanks for listening to this edition of the Toddcast. To learn more, check out the Greater Pensacola Chamber's Facebook page and follow us on Twitter at ToddcastPCola. That's Toddcast, letter P, colon. We hope you join us again next time on the Toddcast.